We've been hearing an awful lot about ObamaCare for a long time now. Open enrollment for the program's health insurance exchanges officially gets underway next month, October 1st. But you may be wondering, what does all of this really mean, and how can it affect your health and your wallet? Here with everything you need to know about this is Fox 29's lifestyle lawyer, Shari Olefson.
Good morning.
Nice to see you. Heck, we've been talking about this, it seems like forever. Nobody seems to understand this, so let's start with the basics. What is this insurance marketplace?
Well, that's real easy, and we're going to drill down into this a little bit more next week. But, you know, while they're filibustering this in Washington this morning, let's tell people what they really need to know. The marketplace is simple. It's a website. It's a place that anyone who doesn't get insurance coverage from their employer can go to shop, easily compare, and actually apply and enroll in one place for their insurance, all your options in one place. It will begin, again, open enrollment begins on October 1st. There are going to be 4 buckets, Roxanne. So you can either choose a bronze, a silver, a gold, or a platinum program, and those programs will determine how much you pay for your premium and what your deductibles are, or your co-insurance, how much of your services you pay for. The marketplace will also tell you if you qualify for government assistance, helping to pay your insurance, and that will depend on how much money you make and the size of your family. And all you need to do is go to healthcare.gov. Now, some of the states are running their own marketplace, but Florida happens to be one of 26 states that's going to go with the federally run website, so Florida won't have its own website.
So how is this health insurance supposed to be better for all of us?
That's easy. There's 3 ways that most folks need to be aware of that this is supposed to be better than what they have now. The first is what's called essential benefits. So there are certain baseline of benefits that have not been required to be provided by all insurance companies, preventive medicine, mental health services, things like that, which will now be required from all healthcare providers. So that includes certain doctor's visits, hospital stays, and so on. The second is that those insurance companies that were playing around with us with denying pre-existing conditions and capping the amounts of benefits we can get each year are no longer going to be able to do that. And then the third is the costs. There will be caps and limitations. You're not going to be able to charge more, for example, because you're a woman. Your insurance company can't charge you more. So those are the things that the new laws require.
So what do we need to know right now to take advantage of these changes that are coming in a week?
Well, the big thing for now is the dates. So the first date is October 1st. Folks can go now to healthcare.gov and just take a look at the website. All the functionality isn't there yet, but starting October 1st, you will be able to go and apply. There's certain information that you'll need to enter. We'll cover that next week. But I'd suggest everyone go look at the website now so at least you know what's coming. If you apply and you pay your premium by December 15th, then you will have insurance coverage by January 1st, which is wonderful. Now, open enrollment ends on March 31st. So if you don't apply by then, unless you have what's called a qualifying event, like a new birth or something significant, you'll have to wait until October to apply again. And the reason they do that, Roxanne, is so that folks don't wait until they have a medical emergency to apply for insurance. Because the whole point of this is that folks who have not had insurance before, and we have almost 4 million people in that bucket in Florida, will get coverage, but it's going to even out the costs between those, people who had been paying more may pay less, people who were paying less may end up paying more.
Well, we'll let that be the last word until next week, and then we'll talk a lot more about ObamaCare.
Details.
Thank you so much, Shari, for trying to hash out a little bit about this and making some sense out of all of it. Let's go over to Kate now for the